I think part of the reason there was the opportunity for equanimity in discourse at the Institute was because there was a clear alternative model that people were able to organize their thoughts and their vision of going forward. I think you can only critique what you've been given for so long and have a reason and have some sort of hopeful conversation for change. There had to be more than just critiquing the predominant model of the sex addiction model. And so I think the thing the Institute did was provide a forum for, first of all, the history of how we got here. And both Dr. Coleman did that beautifully. And then Joe Court took a personal kind of journey through his personal kind of discourse of going from a certified sex addiction therapist and a trauma-focused sex addiction therapist to a sexual health model. And it was beautifully done. And that really set the course then for the rest of the Institute, where then we looked at, neuroimaging and brain research. We looked at assessment. We looked at a sexual health model, which I presented on. And so we sort of built the discourse. The more that was being kind of provided by some of the, the real experts in the field in the country, the more it was empowering people to find their voice in what they think rather than just disparage what they've been given. And I thought that was a very, very significant contribution to the people who were at the Institute.
Oh.
I could just see it throughout the 3.5 days, them building their vocabulary.
Yeah, just completely a powerful, positive experience.
Yeah. And so, that just as an overall experience of the Institute, I thought that was really important. And then I think as the ending of the Institute, I asked David Lay to facilitate the sort of where do we go from here. And I thought he was really a terrific, he really took the moment and helped us all kind of think about where we go from here. And I think that was really important because David's, through his own process after writing The Myth of Sex Addiction, it's clear he's really learned a great deal by being in these rooms and talking with people all over the country. And he was a model of how we begin to move forward because he's moved forward. And so I thought that was really a valuable way for the Institute to end. And people in the room were really beginning to voice and articulate things they see themselves wanting to do. And what I found myself focused on at the very end of the Institute was people were looking at a lot of macro themes and different areas where this could all be addressed. But I actually brought people's perspective back to what we found in the room in the Institute is these moments where people were sharing their own personal fears of honesty and openness and discourse about their conflicts and disagreements and how to handle these in professional, situations. And I invited everybody to think about, just one-on-one conversations is where this is going to be built. We can change systems and we can do lots of macro kind of policy issues and looking at clinical training. But these one-on-one conversations where we create a kind of honest and welcoming kind of discourse to agree or disagree without relying on emotional, demeaning language as our empowerment, I think is really important.
Absolutely. It seems like, if we just keep the point in mind that we're all after the same goal to help educate, help people understand what a model of sexual health is, what a positive model of sexual health is. And if we just keep that in mind, that we have the same goal and same mission, then we can hear each other better and have a more compassionate stance whenever we're talking to each other.
Yep. And I think that people who were at the Institute, got to practice those skills, see them in action, and also got to be exposed to a great deal of information to empower us going forward. That we have an excellent knowledge base. We have an excellent, we stand on the shoulders of fine science and clinical models to offer an alternative to the pathological all of the dilemmas there are with the sex addiction model.
Yeah, absolutely. It sounds like it was a incredibly powerful Summer Institute at AASECT. And, while we're recording this video is that we want to give people who weren't in the room a chance to understand and hear what went on so that we can take a little bit of information and education away from it as well.
Mm-hmm,
Um,
mm-hmm.
Sure. And so you mentioned just a little bit ago the 6 principles of the sexual health model. Can you name those quickly?
For sexual health to be fundamentally present, sex needs to be consensual, non-exploitive, protected from HIV, STIs, and unplanned or unwanted pregnancy. There has to be a degree of honesty that the person feels good about, and it meets their standards of honesty in relationships. There needs to be an understanding of the values and the shared values of sexual activity, both with oneself and with one's partners. And there needs to be the sexual right and the sexual pursuit of pleasure.
Okay, powerful. And I know that you go over those in depth in your book as well.
Yes, yeah. And what I've really been heartened by is that when people hear these 6 principles of sexual health, it's a readily accessible matrix for thinking about sexuality and sexual health. And that some people have said, well, aren't those just a kind of a good set of principles for living?
Sure.
The sexual addiction model is primarily an act-centered sexual values system. What that means is there's a high degree of focus on sexual activity, sexual acts, observable sexual behavior, and that certain sexual acts and behavior get deemed linked or now inextricably for the rest of one's life associated with the onset of an addictive process. So the addiction model says if you engage in these sexual practices or activities, you will engage an addictive process of the brain. And once that, from an addictive model, once that the brain has been sort of, set in this manner, you run the risk of resetting that addictive process the rest of your life through engagement in certain sexual activities. That's an act-centered model. And the sexual health model is a principle-centered model. So rather than focusing on certain sex acts or activities that are associated or deemed kind of inextricably linked or merged or fused now with an addictive process, it's more about building a vision of sexual health. And so these 6 principles, each person has the responsibility of aligning their life with these 6 principles. And so which makes it a principle-centered value system. How do I ensure consent? How do I ensure non-exploitation? How am I meeting a level of honesty in my sexual relationships? And so that doesn't focus on a specific sex act. I pay for sex, or I go to a sexual entertainment site, or I look at sexual imagery for orgasm and sexual pleasure. These sorts of things become more act-centered in a sex addiction model. And so couples and systems are fraught with tension around a specific sex act being frightening or scary, or a risk of endangering the health and well-being of an individual or a family or a marriage. Whereas the principle-centered system says you just need to learn how to live by these agreements and principles of sexual health, and that the actual sexual activity a person may engage in might be very different from individual to individual.
I mean, that's really powerful in and of itself, and it kind of translates to process versus content, right? The content is the behavior or the act, and the process is how we're going about this, and the principles that we use to engage in it. And
Yes.
That's a really powerful kind of transition to thinking of it in that way.
Yes. How are we engaging in a human relationship with each other, and what are the principles that guide us? I like to use the word rudder. These are a rudder for how one makes choices at key moments around their sexual life or their life in general, and that these principles become the kind of framework for making those decisions. Whereas the addiction model might have more of a framework of, I don't do that sex act. That's a repertoire of my sexual life that can no longer happen. And so it's a different way of formulating and going forward.
Yeah, and powerful with longer lasting results, it appears, right? Um,
Well, yeah, I think from my perspective, we're empowering people with a health model rather than continuing to promote out of control sexual behavior as a disordered psychosexual diagnosis. That particularly from the addiction model, once you have that diagnosis, you have that diagnosis for the rest of your life.
yeah, and that's pretty powerful and stigmatizing.
Yeah,
Yeah.
yeah,
So you had mentioned before that there were a bunch of certified sex therapists and certified sex addiction therapists in the room at the same
yes, yes.
how powerful that experience was, what that experience was. Can you speak to kind of that process?
Well, I think what was important was for the respect in which we kind of understood there was a 30-year investment in a for-profit company to create a gold standard for addressing this behavior. And it was promoted, and it filled a vacuum.
Right.
And I think one of the things that was really important for the sex therapists in the room to hear, and the mental health professionals in the room to hear, is the mental health profession and the sex therapy field did not take up addressing out of control sexual behavior 30 years ago. It was avoided. It was not discussed. The field was far more invested in promoting sex positivity and not dealing with the negative aspects of sex. So Dr. Coleman was very good at talking about the sex therapy field has not dealt with sex offending. It has not really dealt specifically with addressing child sexual abuse and non-consensual sex. And it hasn't really dealt very well or invested in understanding people who were having out of control sexual behavior. So the addiction field kind of took up the banner and found it to be very profitable and lucrative, not only to create these inpatient programs that filled a void when the drug and alcohol treatment inpatient field was decimated in the 80s by public policy, but it also filled in the fear of AIDS that was so prominent in the early 80s, that there was so much fear about sexual activity, that the sex addiction model worked very well in its time. It's not as relevant as a model in this time. We know much more, and so having new information that challenges this idea that sex can actually become an addictive process is having to be modulated now, because the fears of the 80s have really subsided, and we have so much more information. And so now we're looking at actually the fears of sexual imagery is the new kind of emerging issue. Now it's the terror that can happen by just access to sexual imagery for arousal, or with youth, actually for sex education.
Right.
If we can let go of the idea that there must be a disorder or a diagnosis or a psychiatric condition in the room that is specific to out of control sexual behavior, and we could look at most of the clients we're working with as having a problem with sexual behavior regulation, worries, problems, and disorders. If we can sort of see that maybe most of the people we're working with have problems with regulating their sexual behavior with other kind of maybe disorders or maybe psychiatric or mental health or substance abuse issues that might be co-occurring, or medical issues as well, that might be co-occurring, and that there might be a small subset of people over time that we will have the scientific ability to measure and diagnose as having possibly a disordered state that's related to out of control sexual behavior. But I think that's going to be a much smaller percentage of the population than is currently seeking treatment. And that I think the lion's share of people that are treatment seeking have problems with regulating their sexual behavior in conjunction with currently well understood mental health and psychiatric and substance abuse issues.
Yeah. So that's really powerful to kind of speak to letting go of these diagnoses, and that's kind of rippled throughout the community, of letting go of the WHO saying we need to let go of the transgender diagnosis as
Yes.
a disorder. And so not only sex addiction, but across all kind of aspects of sexuality, that we must not diagnose.
Yes. And and we talked about even ethics of treatment. Is there something unethical about providing long-term treatment for people who present for compulsive or out of control sexual behavior? And if we're not actually diagnosing them, are we doing unethical things? Maybe fraudulent insurance, billing. I mean, there was lots of ethical questions in the room that I think are really important discussions. So we've really got a lot of complex, nuanced issues to have to talk about.
How did AASECT come to decide this was going to be the institute? Why now?
Oh, Heather, that's a great story. That's a great question. How did AASECT come to about having a summer institute on this topic? So what happened was actually Sally Valentine and the Certification Continuing Education Committee, who certifies CEs that people apply for CEs to distribute AASECT CEs through training, began to notice that there were specific CE requests for AASECT certification trainings on sex addiction. And they began to scrutinize this and really question it, and proposed. They proposed this. The CE committee proposed to no longer approve AASECT continuing education units for sex addiction specific training. Right. And that happened, earlier this year, and so we took a position that AASECT temporarily, until we took a more formal position, would cease providing any approval for sex addictions continuing education. So I thought that was an important statement, well within our purview as AASECT. Right. AASECT determines what's an AASECT CE. It's our thing. We get to decide it, and we decided it doesn't merit that. And then that precipitated a further discussion about where we go. And Susan Stieritz, who's the co-convener of many of the last 7 summer institutes, who's done an amazing job in that role, proposed that this be the subject matter of this AASECT Summer Institute. Because of this, asked me to be the co-convener. They're very honored to be given that position. And we really looked at the Summer Institute as a forum for us to begin to formulate, by bringing some really valuable information in the room, discourse amongst AASECT members, to build what will now be a position statement that AASECT will be making to present to the board of directors as a position statement about sex addiction treatment. And so a small committee has now been formed. Myself is on that committee. Michael Aaron's on that committee. Russell Stambaugh and Michael Vigorito. And the 4 of us are going to be meeting to develop just a draft version of this position. We'll be involving some other people in the organization as we move along for feedback, in time for hopefully a vote in November at the AASECT board meeting in November on a position statement around sex addiction therapy in the United States.
So we have a lot to look forward to in November.